Hi guys, Dr. Boris. I just wanted to talk to you about complications, and I think I've already made the video on this, but I'm going to repeat it again because of the questions that I'm getting. So sometimes the patients come in for lipedema and they want me to be as aggressive as possible, and I get it. The disease is debilitating and you want every little nodule of the lipedema to be gone. The problem with this is, first of all, it's impossible. The location of lipedema nodules can be below the skin, below the fascia, on top of the muscles, and all throughout. So the problem is that whenever we remove lipedema nodules with liposuction, we also remove normal fat tissue. But at some point we have to stop, because if we're too aggressive, we're going to remove all the fat and all the nodules, well, most of the nodules. The problem is it's not going to look good. You're going to have significant indentations and deformity of the leg. I have a lady who sent me the picture asking me to fix the surgery from the previous surgeon, but unfortunately it's impossible to do. So usually I tell my patients I will do as much as I can to improve your pain and discomfort. However, I'm not going to go crazy removing every little nodule, because at the end of the day, it's not going to look good. You want to be able to show off your legs. You want to be able to wear something open if you need to. And with the results that are going to be right here, there's nothing that can be done from my standpoint. So whenever you choose your lipedema surgeon and you want to be aggressive, just make sure that there's a certain degree of common sense of how aggressive you need to be. So take a look at those pictures. You see that this is a normal leg, and you can see it right there. And then right next to it is the result after the aggressive removal. It doesn't look good. I mean, yes, they removed most of the nodules, but you can see all those bumps all over the place. That's a remainder of the nodules. A manual extraction of the lipedema nodules help. It would help if there was not such an aggressive liposuction done. You still have to have a fat layer between the muscle and the skin, between the skin and the muscle. If all of it is gone, it looks horribly deformed, all right? So the point is, go to somebody who knows how to do it. It's not your typical liposuction. And I know some of the plastic surgeons will not agree with me, but once you do it several hundred of cases, you realize your philosophy is different. The technique is a little bit different. Yes, we use the same equipment, but it is not the same technique. And you have to be constantly aware of where your lymphatics are, where you are from the standpoint of the levels of fat, not to damage them, and make sure, especially in the tight areas like in the ankles, you're not going very aggressive in a very superficial layer, because you'll kill the skin, or you scratch the tendon and you can actually have the rupture of the tendon if you go too aggressive on the bottom. So go to the person that knows what they're doing. And finally, I still see the marketing on the internet for these lunchtime lipedema liposuction. I don't understand it, honestly. It's not cosmetic lipo. It's not like you're taking one small area on the hip or something like that. This is a big leg liposuction. It takes 3 hours. What kind of lunchtime can you have? Anyway, thank you for listening, and hopefully it helps.